Namaste. Welcome you all for the yoga session. We will continue with our basic theme, yoga for women's health. This is the fifth in the series. Today we will specially focus on what need to be practiced during the menstrual period or cycle, that 3 to 5 days. What practices should be done? So today we will look at assuming that the periods are reasonably normal. What practices should be done so that the body and mind will be relaxed and emotionally you feel more balanced. Before that, the warming up postures. Actually, during the periods, it may be difficult to fold the legs, pull it closer, and things like that. Therefore, a good way is to use some of the standing postures. So today we are going to use a chair, and of course you will have a couple of blankets. And if you have space near the wall, that is very ideal. So keep the chair like this to the wall and then spread the legs and stand against the wall, back and leg against the wall, pull the kneecap, then roll the pelvis. This is most important, this whole pelvic area, abdomen, that should never be put under stress. Keep your palm, right palm, on the chair. This is Trikonasana. So there is no pressure on the abdomen and pelvis. Pull the kneecap and back against the wall. Breathe at ease, legs straight. If you cannot get the wall, even without the wall support you can do. You should understand that right heel should center the left foot. That's the only requirement. And both legs straight. Left heel to the wall. So take care of that alignment and then slowly come up, then chain. Gently move the chair to your left side, right heel against the wall, left foot 90 degrees out, right hand on the waistline, left hand on the chair and turn. So try to keep the trunk against the wall. So feel the soothing movements at your pelvis and the abdomen. Breathe at ease. Some may have excess flow. What they should do, we will see in the subsequent classes. So these practices are for those who are reasonably, can move without much discomfort. Slowly come up, then gently shifts the chair to the right side. We will repeat Trikonasana. So get the procedure right. The hips and trunk against the wall. Right hand pressed on the seat of the chair. Breathe at ease. Because during the periods, the uterus will exhibit some contractions, essentially to expel the detached endometrium. So we must create more space and freedom for the uterus. Then it can remain quite healthy. Slowly come up and then chair. Shift to the left side. Both legs straight. All other procedures you should follow. Press the outer edge of the right foot. Left palm on the seat of the chair. Both legs straight. Use your breathing to soothe the abdomen and the pelvis. Keep on pulling the kneecap. Slowly come up. We will again take the chair to the right side. We will do Parsvakonasana, legs apart. Left heel to the wall. Turn the left foot inside. If you do not have the support of a wall, you can do it independently, but use the chair. Now flex the right knee at 90 degrees. Rest the right elbow on the chair. Right leg bent at 90 degrees. Again turn the left shoulder, left pelvis towards the wall. Tighten the back of the right thigh, right calf muscle. Breathe well. Feel the soothing stretch, especially at your pelvis. Slowly come up. Then shift the chair gently to the left side. Legs apart. Keeping the right leg straight. Bend your left leg. Rest the left elbow and turn the right shoulder towards the wall. So when you do with the wall, you get a good reference. But in any case, use a chair, even if you don't have the support of a wall, because by using the chair, you are highly minimizing the load that would come on the abdomen and pelvis. Slowly come up. One more time. Please remember, we are doing this as a preparatory postures during the menstruation. Bend your right leg at 90 degrees, right elbow pressed, left heel to the wall, turn the left foot inside, press the outer edge of the left foot. Breathe at ease. Never strain the breathing. Inhale, pelvis and abdomen should smoothly, gently expand. Exhale, it should simply contract. Then chain. Move to the left side, legs apart, left elbow on the chair, left heel should center the right foot. So this also helps your back. Because during the menstrual period, the back could also feel stiff and weak. There could be fatigue in the legs. So these standing postures will help to relieve all that. Slowly come up. Sit down. So what we have done is simple postures of standing with chair support. That is important. If you also get the wall support, ideal. Else at least with the chair support you should do, so that it tones the core muscles. Now take a blanket, fold it, then put this against the wall and sit on the blanket with the back against the wall, cross-legged. You have to sit upright. Always ensure that hips are at a height than the foot. Sit upright, watch your breathing. The whole idea is that we always tend to relax the pelvis and the abdomen. Now keep the chair in front, and on top of the chair you can keep a blanket or even a dupatta will do. Just fold the dupatta and keep it here, so that we are going to rest the forehead here. It should be soft for the forehead. Chest and envelope. Hips against the wall. Sit upright, then gently lean forward and rest the forehead on the chair. Don't allow the back to drop. With a gentle forward bend, you can flex the arms. Watch your breathing. All these supported forward bends will impart a lot of relaxation. during the menstrual periods, because of hormonal variations, some mood swings, cause premenstrual syndrome, but for some people it extends even during the periods. But in any case, during periods time, these kind of relaxations are imperative. And especially watch your breathing. Slowly inhale, slowly exhale, and especially during periods, make the exhalation very normal, natural. That is, don't further contract the abdomen and pelvis to make the exhalation longer, which we do in during other time. Here it should be very, very soothing action. Slowly inhale, then slowly exhale. Watch the transition between inhalation and exhalation and inhalation. You have to slowly inhale, then there is a changeover from inhalation to exhalation, a small pause. Pay attention. Similarly, after you exhale, before you inhale, there is a small pause. Capture that. Watch your lower back. And you should stay in this posture. Very important. You should stay for 2 to 5 minutes. Should keep the eyes closed and just place the forehead on the seat chair. Then slowly come up. So the supported forward bends are excellent, especially during period time, because these days, you know, women, even during periods, they need to actually do their other works also. Therefore, it's very important for them to recoup the energy, refill themselves as quickly as possible. Now, you do Baddha Konasana. Back against the wall, join the feet and then push the knee towards the floor. Watch your breathing. Feel the complete pelvis, the groin, that is the root of the thighs. Breathe gently. So this helps all the pelvic floor muscles. And Baddha Konasana gives more space for you to rest. There is a lateral expansion of the pelvis. Feel, and especially during the menstrual cycles, don't do any of these movements that would create some sort of a squeezing action of the abdomen and pelvis, and avoid practices which are very exhaustive, which involves jumping, which involves compression. Such things you should avoid. Of course, today there are many women in the sports. So they have to participate. Yes, even for them, if they do these things as their morning routine, then it would help them a lot to participate in this more rigorous sports activities also. So it's a question of training both the body, mind and emotions. Now take the chair forward. Again keep the dupatta or another blanket, chest and navel up. Gently lean forward. Push the knee down. You have to lean forward, which means there is no compression or flex the low back. You have to stretch the low back. Again, same principle. Watch your breathing, watch your pelvis, abdomen, watch your lower back, watch the thick skin at the lower back, the lumbar fascia. Watch your breathing. Feel the effect of resting the center of the eyebrows. Don't press the eyes closed. Pay attention to all the intricacies of breathing. Slowly inhale. Feel the expansion of pelvis and abdomen all around. Then watch that pause. Then simply let go the breath. Exhale freely. Again watch that pause before you inhale. So the more and more you get involved, you will see that you will relax faster and better. Be focused. Now slowly. So ensure that you stay for about 2 to 5 minutes. Especially during your menstrual periods, don't hurry through your practice. Try to be slow, gentle, soothing. Now sit in Swastikasana. So these forward bends will help you to immediately relax. Now stretch both legs forward, both legs forward, as in Dandasana. So your back against the wall. So you are sitting at a height. If this height is not comforting, you can increase the height. You can put one more blanket. But ensure that legs are at lower level than the hips. Now fold your right leg in Padmasana. That is, take the heel to the pubis and drop the knee. So this is somewhat wide angle Padmasana. So actually we do like this. Take it closer, heel into the abdomen and both the thighs run parallel. Don't do that. Take it close to the pubic bone and drop. So that this whole space is relieved of any pressure. Watch your breathing. Stretch your right leg forward, then left leg. Take the heel towards the pubis, resting the left foot on the right thigh. Right leg straight, pull the kneecap, push the left knee down, back against the wall, sit upright. Watch your breathing. Angle, please remember that, because this will help the legs and the knees also. And it will also prepare the pelvis for the next movement. Stretch left leg also forward. Cross the legs. Now keep the chair front. Both legs forward. Now right leg, same. Padmasana with that wide angle. Legs straight. Stretch the trunk and then bend forward. Rest the forehead. Breathe at ease. Don't push the chair too forward. Breathe well. Left leg absolutely straight. Slowly come up. Stretch your right leg forward. Then left leg. Fold. So watch the movement at the left knee. So this will relieve the stress on your knee. Gently bend forward, right leg straight. Right toes towards the knee. Stretch the trunk. You can keep the arms at ease. You don't have to stretch the arms. Don't strain the neck. Just comfortably rest the region between the eyebrows. Keep the eyes closed. Slowly come up. Sit in cross-legged. So earlier days, in not only in our culture, in most of the cultures, during the menstrual period, women were not allowed to do any work. Because there are other taboos with it, we will not go into that, but in summary, yes, rest was one of the things. But now things have changed, and a lot of understanding has come into the nature of chemistry that takes place, and it is possible through some of these techniques to reasonably alleviate such discomforts. Now we are going to do Upavishta Konasana. Take the legs to the side. Don't have to spread it too much apart. Back against the wall, sit upright. This is also a very, very good posture. It also creates more freedom for this. Watch your breathing. That is the key, because the hormonal variations will induce some sort of restlessness. So if you focus on your breathing, that can be effectively handled. And if you keep on training month after month, then this adoption will become much easier than, because it is all question of training the body and the mind. Because mind plays a very, very powerful role. Now chair is in front, slowly lean forward, ensure that your thighs don't rotate, that is, keep this alignment of thigh, knee, shin and the calf in same line. Don't tilt the foot either. Slowly bend, stretch the trunk, rest the forehead on the dupatta. Watch your breathing. Trunk and navel up. Watch your breathing very, very carefully. A good awareness is essential. Keep the legs straight. So these postures will help you to feel emotionally more balanced. The twitching sensations and cramps in the abdomen also gets reduced. And all these forward bends you have to stay for at least 2 minutes. 5 minutes would be great. Slowly come up. Join the legs. Sit in Swastikasana. Sit upright. So this Baddha Konasana, Upashta Konasana, they are excellent and they should be done with proper awareness with regard to the breathing. You must know that you are trying to soothe your pelvis and abdomen. And you must work with that intention and that belief that yes, this is going to help. That is also very, very important. Now stretch both legs forward. We are going to do one more forward bend. Fold your right leg, taking the heel to the root of the left thigh and right knee back. You have to go, maybe I will show this way. Stretch both legs forward. So take the right knee as far back as possible. Sit upright. You are little diagonal. Okay. That is right thigh, left thigh. This is in between is the chest. Left leg absolutely straight, then bend forward. Rest the forehead. Hope I am clear. We are not bending in the direction of the leg, it is diagonal. You must remember not to the pelvis and abdomen. You must stretch them. You must rest the forehead on the dupatta, the seat of the chair, and breathe with awareness. Imagine the divine prana is going in when you inhale, and all your discomforts are going out as you exhale. Slowly come up. Then stretch both legs forward. Now fold your left leg, taking the heel to the root of the right thigh, right leg straight. So now chair is here. The orientation of the leg is this side. So this is diagonally you should stretch so that your region around the groin does not get compressed for any reason. Chest and develop and then slowly bend forward. Keep the right leg straight. Watch your groin, the pelvis, floor of the pelvis. Keep the right leg straight. Slowly come up. So some women will have, some sort of a bloating experience. So this movement will also elevate such things. Now sitting cross-legged. Sit upright. I also would recommend that you get, this is the bolster, cotton studded, about 3 cotton. If you have two such things, a lot more you can do, especially women, because during menstrual periods and also during many other phases, supported are very good. So sit upright against the wall, hips on the blanket, foot on the floor. Watch your breathing. Keep the tip of the thumb against the tip of the little finger. Tip of the thumb against the little finger. Little finger is associated with the Jala Tattva. Jala includes the blood also. So, palm should face upwards. Remain seated upright with the back against the wall. Watch your breathing. Slowly inhale, slowly exhale. If your inhalation is 4 seconds, try to make the exhalation also 4 seconds, but don't force yourself. Else you reduce the duration of inhalation. 3 seconds inhalation, 3 seconds exhalation. But ensure that they are in 1:1 ratio. Now we are going to do the Ujjayi pranayama. You have to tighten the muscles of the throat slightly. Then slowly inhale and exhale. Watch that soothing sound of the inhalation and exhalation. If you are comfortable, do the chin lock, Jalandhara Bandha, chin to the chest. Contract the muscles of the throat, then slowly inhale and slowly exhale. You are also doing the Jala Mudra, tip of the thumb against the tip of the pinky, little finger. Now you are doing Ujjayi Pranayama. So you have to be slow and gentle. Exhalation should be almost effortless. You have to slowly inhale. Feel the expansion of pelvis and abdomen all around. Then feel that pause. Then simply let go the breath. Then feel the pause. Slowly inhale. Be watchful. Ujjayi Pranayama. It helps your lungs and heart. It also gives you that elevated feeling of victory. The mind feels more delightful because the menstrual period is also some sort of a, for many women, it is a low mood condition. So the Ujjayi Pranayama will elevate the mind to feel more delightful. Okay. Rise your head up, relax your breathing. You can continue with the Jalamudra, because we are going to now do the Brahmari Pranayama, which is also very relaxing. And you must adopt your mind for a very slow, steady practice. During ministration also, you should not get into that rush feel. So you must learn to stay in the postures, feel the postures, go deeper. So now you have to slowly inhale. As you exhale, pronounce the word hum internally without moving the tongue or the lips, purely internally, and feel the vibrations in the region of the brain. You can join with me. Slowly inhale. Be relaxed. Relax the mudra also. So we are going to continue with some more techniques which will help a woman to smoothly go through the menstrual periods. Of course, we are showing many postures. So you have to practice these things and find out which is very optimal for you and adopt them. Because whatever we are going to show, if you practice everything, time may be a constraint. So our main idea is to show different forms and whichever is most crucial we will indicate. Other things you can treat as, you have to work and find out what is your optimal postures. Salutation to Sage Patanjali. Take a deep breath. योगेन चित्तस्य पदेन वाचा मलं शरीरं यस्य च वैद्यकेन योपाकरोत्तं प्रवरं मुनीनां पतञ्जलिं प्राञ्जलिरानतोऽस्मि हरि ओम। श्री कृष्णार्पणमस्तु। श्री गुरुभ्यो नमः। शुभमस्तु।